As plastic surgeons, we've all had times when we thought we did the perfect surgery, and unfortunately we don't always get the perfect results. And sometimes that's not our fault, right? Steve, have you had patients who maybe don't cooperate?
Well, I think the biggest non-cooperative thing is when people get back to too much activity too early, and that's the biggest problem that I've had with folks either having, God forbid, a hematoma or something like that, or just swelling that it takes so long to get rid of. They go back to exercise, they get their blood pressure jacked up, and then, unfortunately, it slows their recovery process.
But I mean, everybody, they always listen to you, right? They do exactly what you say.
I'm astounded how, even though we have them sign what they have to do, they have to be very careful. And then the next thing you know, they do housework, they go to the gym. So those types of things lead to, in my opinion, lead to delayed recovery in the long term.
And so Dr. Seckel was saying, on surgical procedures, but I mean, it's safe, right? It's completely safe when we're doing non-surgical procedures, and they don't necessarily have to listen to you on those things.
Well, it's the same sort of thing, and I actually put this one to the test myself. If you exercise after having a Botox injection, it doesn't set up and last as well. So I think you really have to give people guidelines. I put things in print for folks to look at so that they not only hear it from me, but they see it, and there's a lot of reference, and then we reiterate at their post-op visits to make sure that they're following an appropriate regimen.
What are the key things in terms of following directions, making sure you have a good outcome?
I think, lack of mobility, especially breast augmentation, faceless procedures like that. I encourage them, I want them to be up and go to the dinner table, go to the bathroom, take a slow walk with somebody who's got their arm. So I think the key is that they don't overdo it.
I had a patient fall down, miraculously on New Year's Eve once and cause a problem. But, they're doing too much too early, and that's the biggest problem.
I think the message here, right, is that it's a two-way street. It's incumbent upon us as plastic surgeons to do our part in the operating room, our part in the office, but it's incumbent upon the patients to also do their part and listen to us and just follow directions, because we want to get an excellent outcome. If you want to see stories like this, please tune into theplasticsurgerychannel.com.